if you're studying for the CHT, you're going to want to grab this book. It is Hand Therapy Exam Success, the Ultimate Book of Practice Questions by me, Huang, and my co-authors, Vanessa and Alina. So we wrote this book for anyone who's studying and wants practice questions. There's probably over 800 questions, and I'm going to share with you a little bit about we're going to do some questions together. How about that? So let me just share with you, I'm going to share with you the digital so you can kind of go through it with me, but this is what it looks like inside, and it's 10 chapters, with the chapters 2 through 9 being the bulk of all the questions, right? Chapter 1, be the CHT before you become the CHT. So this is where I share my tips, my strategies, my curriculum that we teach inside the exam prep program. So if you're not in the program, you want to learn more about the way it's structured, I'm spelling it out right here because that's what I recommend. That's what I take my students through. So I want to help take you through it as well. And there's some tips in there. Chapters 2 is going to be tips for studying hand topics and answering questions. And so the way it is laid out, let me see. I'm going to share with you. Chapter 2. Tips. So the first couple of pages, just my tips, and I share with you my fast track framework and all that good stuff. And then we're going to dive into questions. And so all the questions are just questions, and that way you can't cheat. All right, you're going to do all your questions. There's about, over here there's 110 questions, and then you're going to get to this section where it says questions and answers. And here it's going to have your corresponding question with the answer and a short explanation. Now, I don't believe that there's just one resource that you can use when it comes to studying. You know me, I'm a big believer in, oh my God, the rehab of the hand, right? It's just what the HTCC recommends, and so it's one of my biggest sources for, and it's in here, it's a reference, for going back and learning, like if you didn't get the question right, where's the answer? It's in here, right? And it's going to take you, everything is going to take you back to a particular chapter or a particular page. Now, like I said, there is a small explanation, but this book is not here to teach you these major concepts. It would be 3 times the size if it was also teaching you. That book is coming. Questions, the Ultimate Book of Practice Questions, is about practicing the questions, right? Let's dive into hands. Let me pull that up. Let me see if I can share screen. Oh. Well, let me share. We'll edit this, and then we can share screen or window. Let me see. Oh, here it is. All right, let's do about 5 of these questions together, right? Questions for hands. Number 1, following a complex dorsal PIP joint dislocation with an avulsion fracture, the joint was immobilized in 40 degrees of flexion to maintain a reduction. An unsuccessful attempt to treat in extension at another clinic for 4 weeks has led to a PIP flexion contracture. Now cleared to regain extension, how would you proceed with treatment? Can you see that? Oh, I hate that it's cutting off some of the questions. Sorry. All right, I'll read it. A, perform lumbrical strengthening exercises to strengthen PIP joints. B, serial cast PIP joint into extension. C, attempt to fully extend the PIP joint using extreme manual force. D, discharge the patient from a PIP capsulectomy as needed. Discharge the patient because a PIP capsulectomy is needed. Hello, you gotta read. I was talking about me. So that's number 1. Write your answer down, right? Write your answer down. You can pause on my face, read the question, pick the answer. All right. Let's go to question number 2, and I'm going to give you the answers after. Question number 2. What percentage of grip strength asymmetry is typically observed between the dominant and non-dominant hands in the right hand dominant individual? A is 20 to 30%, B is 10 to 15%, C is 5 to 10%, and D is 1 to 5%. I'm gonna figure out how I can move my face over. Oh, I can move my face over. Hello. Oh, I can move the questions over. Dear Lord, have mercy. Who would have thunk? There we go. How's that look now? You can totally read it, right? You can totally see it. All right, boom, done. All right, let's go to the next. Ooh. Let's go to the next question. No, I was trying not to. Nope. Oh my God, dear Lord. Okay. Let me stop. Okay, let me stop messing around with this. All right, number 3. Number 3. Which of the following muscles receives innervation from both ulnar and median nerve? A, flexor digitorum superficialis. B, anterosus. C, flexor digitorum profundus. D, flexor pollicis longus. Now, what was I going to say? Now, when I am thinking through these questions, some of them are just going to be general knowledge, and some of them are going to be applied. So applied meaning you have to take a lot of the information you already know and then make decisions around it. Remember, the exam is divided into 4 major domains, and I do explain it inside this ultimate book of practice questions, and so you can get the tips and stuff like that as well in there. All right, let's move on to number 4. A therapist is performing an initial evaluation of a 27-year-old left-handed male with lateral epicondylitis. When measuring grip strength, the therapist should consider which of the following. Left-hand dominant individuals have equal grip strength on both hands. Left dominant individuals have 5% less grip strength on dominant hand. C, left-hand dominant individuals have 10% less grip strength on the non-dominant hand. And D, all of the above should be considered. I will tell you that there's not a lot of all the above types of options in the textbook. We just have like once in a while. But I try to mimic these questions as close to the exam as possible, in the sense that, you know, the topics, the domains, they have questions and they have 4 choices. There's no mix and match. There's no all of the above, A, C, but not this and that. So I try to keep it like as consistent as possible when I was creating these questions. All right, last question before I share with you the answers, right? So 5, after playing basketball, your male patient inquired, let me start over. Number 5, after playing basketball, your male patient injured his MP joints when the ball accidentally jammed into his fingers really hard. Your patient wants to try conservative route before trying surgery. What is the recommended position you should place his IP joints in? Fully flexed, fully extended, flex 50 to 70 degrees, and then D is adducted. All right. So think about your questions there. Think about your answers there. All right. Let me get the answers. Now, before I get the answers, if you're interested in purchasing this book, I'm going to include the link for you so you can purchase from my website. Of course, you're also allowed to go to Amazon, but you won't get the bonuses that I provide with you with the purchase when you get it from me. And if you're interested in getting more help, there is the exam prep on demand, and you can join that at any time. And I'll include the link for you as well.